Forgot to do that. Because if anybody is missing, you can watch later. Anybody is missing, you can watch later. Yeah. So, right. Now let us just recall. Okay. You hear a dentist, and this dentist is talking to a trainee dental nurse. A dentist is talking to a trainee dental nurse. So, he is explaining something. He is explaining. That means this is an ongoing action happening now. This dialogue is happening now, live. You have to remember that. Now, here, the action in progress, the dialogue in progress. So, he is explaining something. Why is he explaining something? Because that is very important. It's a protocol. There should not be a mistake, maybe. It is very important. If something goes wrong, it will be problematic. He doesn't want them to miss this one. That's why. Only if we tell them, but we are explaining. Explaining means telling everything about it. Explain in detail. Telling shortly, but explaining step by step in detailed manner. That is called explaining. Okay. Systematically, that is explaining. Talking or telling is something. But explaining means, so to avoid any confusion, so clarity to be maintained, there should be perfection. See, why I'm explaining so much? I can tell you, I can just talk, but I'm explaining you in detail, step by step, part by part, word by word. Why? Because it is very, very important. I don't want you to miss any mark. That's why. So he is explaining. That means he means dentist. Dentist is explaining. Okay. Dentist is explaining. And the trainee dental nurse is listening. So he is explaining. He means male. And if dentist is male, then the other person is female. The other person, trainee dental nurse, is female. Okay. So she, that's it. That's what you have to understand here. Now, so here if you see what to do in the event of actual injury, accidental injury. So he's talking about an injury, accidental injury. About accidental injury. So procedure for accidental injury, what to do? What are the steps involved in the procedure if there is an accidental injury to the patient? Okay. There's an accidental injury to a patient. The patient is already there. By accident, he has an injury. Then what to do? What are the steps to follow in the future? Next, the need to put patients at ease before a procedure. So this is an injury and this is a procedure. So injury and procedure. Is he talking about injury or an accident? Or is he talking about a procedure? So The proper positioning of a piece of equipment. Okay, what to do in the event of accidental injury to a patient? The need to put patients at ease before a procedure, and the proper positioning of a piece of equipment. So is it talking about injury focus? Is he explaining about the steps to be taken in the event of an accidental injury? Number one, injury. So focusing on injury. Injury. Next one, the need to put patients at ease before a procedure. So there is a procedure, and before that procedure, the patients may be confused. So you have to inform the patients and make them comfortable before a procedure. So is he telling why we should put the patients at ease, comfortable before a procedure? Because if you make them comfortable, then only the procedure will be successful. If the patients are not comfortable, they will not be interested in the procedure. They will be against. They don't want. They will be in shock or panic or confusion or anxiety. Then the results may not be excellent. There may be some problems, complications. So that's why before we start a procedure, the comfort of the patient is important. So patient's comfort, at ease. So patient's comfort is more important. When is it regarding injury? No, it is regarding procedure. So he's going into the operation theater or there's a procedure. So first make him comfortable. For example, there is a wound, there is an injury. You want to put dressing. So before dressing, you clean. For cleaning, you use iodine. And when you use iodine, it burns a little bit. Burning sensation. You know everything. So patient is afraid. Will this burn? Will this trouble? Can I bear it? So you have to tell him little pain will be there, but you can definitely bear it. No problem. Just bear it for just 5 seconds and everything will be normal. Okay. Everything will be normal. So you have to make the patient comfortable. Otherwise, what he will do when you start putting iodine, he will be pulling his legs. Instead of holding the legs strong, he'll just pull his legs back and says, I don't want. Or maybe small child, for example, they will run away. Okay. So first, keeping them comfortable is very important. So next, third one, the proper positioning of a piece of equipment. Equipment is the problem. Okay. Equipment is the problem. So the machinery, the equipment. So the proper positioning. So how to position the piece of equipment. For example, you have some equipment, how to fix it properly. For example, nasogastric tube, how to position it properly before the procedure. Okay. Injury. For example, there is an injury. After injury, there will be a procedure. In the procedure, you will be using an equipment. So injury, what to do? Procedure, how to put the patient comfortable. So third one, equipment, positioning. So the key words, the most important words now are here. Now, what to do in the event of an accident? What to do? Who will do? Nurse. To do is very important. To do during injury. If there is an injury, what to do? So what you have to do is more important. So that means the procedure, the steps, what you have to do. The procedure is important here. Okay. In the injury, procedure is important. Now, before the procedure, making the patients comfortable. So ease. patient's comfort. So patient should be comfortable. First one, you should know everything before accidental injury, before you do some assistance regarding accidental injury. You are the problem there. You don't know, so you have to do something. Next one, when you are doing something, you have to keep the patient comfortable. First one, you have to do something in the case of accidental injury. That is A. You have to do something. If you are doing something, that is procedure. B. You are doing something means procedure. So in the procedure, keeping the patient comfortable. So patient is a problem here. Patient is a problem here. Here, you are the problem. Nurse is a problem. What to do? If the nurse doesn't know what to do, that's a problem. So here, nurse problem. Okay. Problem is related to nurse. Nurse has to know what she has to do. Okay. Here is the problem of the nurse. Remember that. This is the problem of the nurse. Nurse should know what to do in the event of an accident. In not injury, what you have to do in the event of an accidental injury. Injury, nurse. Injury, nurse should know everything what to do. That's it. Nurse problem. Because she doesn't know. She's a trainee dental nurse. So you should know. If you don't know, it is your problem. That's the meaning. Second one is you are starting a procedure because you know you are starting a procedure. But before starting a procedure, first one is what you should do, what you should know. Now you know. So then because you know, you'll start a procedure. If you don't know, you cannot start. So you are the problem, A. B, you know what to do. So you are not the problem. You are not a problem now because you know everything. A, nurse doesn't know anything. Okay. That's why she should know. So nurse is the problem. And in B, so you are going, you know what to do. So you are going for a procedure. So when you are going for a procedure, the patient is a problem. You are not a problem here because you know everything. But the patient doesn't know anything. So the patient is not comfortable. Say, I don't want, I'm scared, I'm afraid. So patient is the problem here. So who is the problem here? The patient. Yeah, the problem is with the patient. See what angles I am showing you. So here the patient is the problem in B. In nurse, A, nurse is the problem because she does not know what to do. So she has to know what to do. So he is explaining what to do. So nurse problem. So he is explaining nurse how to do. Second one, nurse knows everything and procedure is going to happen. So patient is the problem. So problem is not with the nurse because she knows everything what to do. So she is ready for a procedure. So the patient is the problem. Why? Patient is confused. Patient is anxious. Patient is worried. Patient is tensed. He is afraid. He is scared. Now what he will do? Even for wound dressing, he is scared. Iodine burns. Suddenly you put iodine, it becomes cold and it burns something like burning feeling, burning sensation. Okay. So once you put like that, next time again like that one means you'll feel you don't want, you'll pull your leg. What is there? What is this you are putting? What is small children? They don't know. They'll pull their legs. They don't want anything. They're afraid. Yes. So they will be confused and they don't know what to do and they will be a problem to you. They will not allow you to do the procedure. So before doing the procedure itself, you have to make him comfortable. You have to tell everything what you are going to do. So you are making them comfortable. So patient is the problem because patient is not comfortable. He is upset, he is panicked, he is worried, he is tensed. And he may be angry also because you are doing something without telling him anything. So you have to tell them and you have to comfort them. You have to make them peaceful. Okay. You have to take his consent and say, yes, go ahead. So now you can go because if he doesn't give consent, that means he may withdraw at any time. So the problem is with the patient. He may even slap you. He may even push you and say, get lost. He may shout at you. Anything he can do because patient is not comfortable. I hope you understand the patient's problem now. Okay. So Third one. Third one. Now, there is no problem with the nurse because nurse knows everything. Second one. There is no problem with the patient because nurse explained everything. Now, when you are doing the procedure, you have to position the equipment. For example, when you are doing CT scan, you have to position the equipment properly. Okay. If you are measuring something, you have to position that one properly. X-ray. X-ray should be positioned properly. Your chin should be positioned properly. Okay. Height, distance, all these things, they should be positioned properly. For example, you are transfusing blood. That's a procedure. Blood transfusion, it's a procedure. Okay. Patient will be afraid. Definitely. When you are taking blood, patient, when you are giving blood, or when you are taking blood, anyway, patient may be scared. Okay, I am scared of needles. A small procedure, giving injections, but still I am scared. So what I'll do? When you're doing something, I'll pull my leg. I don't want to take injection. I'll be pushing. If I get angry, I'll be very wild also, and I will hurt somebody. Otherwise, the needle may break, or the syringe may break, or okay, injection gets spilled. Everything, anything may happen. That is B. And the third one, so patient is comfortable. Now, equipment problem, the machinery problem. See, for example, you have to give it a certain angle. If you want to draw blood, you have to allow the needle to go into the vein or artery, and then you have to leave the needle point within the blood vessel. So it should not pass through one side to the other side of the blood vessel. Okay. So that you can draw the blood. If it goes to the other side, outside, then you cannot draw blood again. So positioning should be proper. Anything like that. Everything should be perfect. Perfectly placed. Position is very important. Position is very important. So when you position it properly, then only it will work properly. So positioning is, so first one, nurse is the problem because nurse does not know what to do. So nurse is the problem. So doctor is explaining nurse what to do because she doesn't know. Next one, number two, because this is a trainee nurse, nothing she may know, but he may be teaching him everything. But in this episode, in this part of discussion, what is he teaching? Is he talking about training the nurse? Or is he talking about making the patient comfortable? Or is he talking about positioning the equipment? So which is the priority here? Which is the priority here? Okay. Procedure is the priority or patient is the priority? First one is procedure. So procedure is the priority. Second one, patient is the priority because he is afraid of the procedure. First one, the nurse doesn't know how to do the procedure. Second one, nurse knows the patient procedure, but patient is afraid of the procedure. So comfort is more important. Third one, patient is also comfortable. So no problem with the patient also, no problem with the nurse also now. Nurse knows everything. Patient is also explained everything and he is cool and relaxed now. So now what is remaining? Equipment. When you are doing a procedure, the equipment should be properly positioned. If you put improper positioning, there may be some disastrous or detrimental impacts. So the problem is with the equipment. You did not put it right. You did not put it right. You did not place it right. So you have to place it properly. That's very, very important. How you are positioning is very important. So first one is concentrating on the nurse and the procedure. Second one is concentrating on the patient and comfort. Third one is focusing on equipment and position. Remember that. So third one is equipment or machinery and position placement. Second one is patient is anxious, psychological impact because you are doing a procedure for the first time or second time or third time. So he has some impact. So his comfort is very important. If he's not comfortable, anything may happen. First one, nurse does not know the procedure. So the procedure is explained to the nurse. So nurse is the problem. Second one, patient is the problem. Third one is equipment is the problem. Yeah. Right. That's how it goes. Why I'm explaining? Because this is the first question today. So red means problem. So he's explaining because there is some problem. What is that problem? Is it the nurse problem? She doesn't know anything. Is it the patient problem? Because he doesn't know anything. Is it the equipment problem? Because there is some mistake in placing it or positioning it. So nurse is the problem, patient is the problem, equipment is the problem. So nurse is the problem because she lacks knowledge, patient is the problem because he's afraid, equipment is the problem because position. That's it. So knowledge, comfort, and position. Different angles. Injury, procedure, equipment, or patient, nurse, and equipment, or knowledge, comfort, and position. So these are the different angles you have to focus. So knowledge. Nurse should have an idea about what to do. That is A. Patient is anxious. So anxiety should be removed. Okay. Patient should be explained. Then only he will be comfortable. If he doesn't know what you are doing, he will panic. So he should be comfortable. Without the cooperation of the patient, you cannot do anything. So be the patient comfortable. So comfort. First one is give knowledge to the nurse. Second one is give comfort to the patient and keep proper position for the equipment position. So knowledge, comfort, position. See, three different angles I have explained you. Yeah, I'm not joking. See, this is how you have to analyze. If you understand like this, before the beep sound, when the beep sound comes, afterwards it's easy for you to grasp. So make the mental ground rehearsals well before you start listening. Do proper rehearsals, and it is easy for you in the exam. Now let us see. Because this is the first question I have explained in detail. Not all questions I'll explain like this, okay? Now let us start. Anuja. Hello, Anuja.
Yes, sir.
Am I clear now?
Yes, sir. It is clear.
You understand the depth of this question?
Yeah,
Three
but I
different
did.
angles I have
You
told.
didn't think
Correct?
like that. Yeah, before.
Huh? So in the
I
time
didn't.
given before the beep, you have to think like that. What many people do is just to wait for the audio. What is happening? What is happening like that? They don't do this pre-listening. This is in listening. There are three stages: pre-listening, while listening, and post-listening. Pre-listening, you guess. While listening, you listen. Post-listening, you check. You understand now?
Yes, sir.
So this is pre-listening. I'm teaching you pre-listening today. How to make the best of your. I'm not explaining the answer here. I'm not making you to listen now, but I'm telling you how to be prepared when the listening comes. This is the first stage. Listening you can do. Once you listen, automatically you get the answer. But mentally you have to make the ground ready, right?
Yeah, yeah.
Yeah, next.
Thank you
Anu.
very much, sir.
Yeah. Anuja, you can tell in a few words. You can tell in a few words how this benefited you.
Yes, sir. Actually, it's good, sir. Actually,
Mm,
I don't have any idea about how to be preparing when it's pre-listening.
mm,
We just doing what's going on next step. My mind is always focusing for the audio,
mm,
not pre-listening.
mm,
Yeah, I now I get the idea from you, sir. I
mm.
think I will try to this method. I never use this method. I never think about pre-listening. I just uh, use the
Direct
find
to the
the
audio,
keywords.
right?
Yeah,
Live
focusing the audio.
performance. Live performance. Correct?
Sorry, I couldn't hear.
Live performance. Directly audio, you'll catch and you'll write like that, you are thinking. Correct?
Yeah, yes, sir. Yeah,
See how much background we did. Correct? If you do like this for 5 to 10 sets, then it will be easy for you later. Without suddenly it will come, like how it is coming to me, it will come to you. Okay? But practice.
yes, sir.
Immediately it will not come. Within one day it will not come. Okay? At least 5 to 6 tests you should do like this before listening.
Okay,
Okay?
sir.
Today
Okay,
you
sir.
take one
Thank you.
test, two tests like this, and just to do like this. Afterwards, tomorrow you can do the test so that you'll get the
Yeah.
hang of what I'm teaching you. Yeah. Yes. Okay. Thank you very much.
Yes.
Yeah. Next, Anuja. Anuja, you are saying something. Come on. So, how did this
Anu,
benefit you?
yes, no, I thought Anu is Anuja, like, because I thought.
No problem. No problem. Come on. Tell me. Tell me, Anuja.
Uh, no, sir, I don't have experience like this
Hmm.
before, sir.
This
I done
Simon is very
something
mad. He is
before.
one question. So much time he is explaining. Why mad? This mad fellow. Correct.
No, no, sir. Actually, now we can think about that.
Hmm. If you
Some
say no,
different.
sir, then that means you are mad students and I'm mad teacher. I'm mad professor, you are mad students like that. Everyone will think like that. No problem for us because we want to learn, we want to improve, we want to be the best. That's all. Correct?
Yes, sir.
Yeah. What did you learn today?
Sir, in part B,
Hmm.
uh, I don't know like this method
Hmm.
before.
Hmm.
Only I'm listening to audio and doing that.
Hmm.
So but now I can understand that difference between A, B, and C as well.
Hmm.
Thank you very much, sir.
Welcome. Welcome. So first one is knowledge. Second one is comfort. Third one is position of the equipment. Knowledge for the nurse, comfort for the patient, and position for the equipment. So knowledge, comfort, position. That's very clear. So next, who is the next one? Buddhi, Budika, Budika.
Yes, sir. It's a
Budika
very
is angry with me.
beneficial
Maybe
for
she's
me.
not talking. See, why you are angry, Budika?
No, no, no.
Come on.
Yes, sir.
Yeah, speak, speak, speak.
Yes, sir, it's a very beneficial for me because of the today I am understood how to catch the keyword before listening and
Mm,
how to identify the different answers, different
mm,
answers and keywords before listening. And I understood the how to prepare the before listening. It's very beneficial for me, sir.
mm.
Thank
That's
you.
really great. That's really great. Next one is Dinusha.
But I just want to the session with this question. Still, I didn't say clear idea. Uh, I would like to like reintroduce this learning. The
Yeah, what new things did you learn today?
so I just log into this master. So I just start to follow this one.
Okay, fine. That's very good. Yeah, Dunisha.
Yes, sir. Before I didn't analyze that much deep. to the of that question. I
Hmm.
just mark the keywords and I follow the audio to catch the answer. So I think today's today I got very beneficial lesson to understand how to use that keyword much accuracy and get the answer. Thank you, sir.
Very good, very good. So, Dinusha, I just joined the session, sir, from this question. Yeah, this is the first question. Previous question, previous part A is already finished. This is now only started, first question only. Part B, first question only, Dinusha, no problem. Okay, no problem. Yeah. Dinisha, what specifically did you learn today? Anything new?
Yeah, sir. I didn't analyze that much depth, sir. That's the new thing. I didn't think so that much before. So I just marked the keywords and only focus that keywords. So I didn't analyze that much. So I
Okay,
think it's a
good.
new thing.
Good, 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 good. Odion. Odion. Odi. O.
Sir,
Yes.
yes, sir. I actually listened. I followed your explanation and what exactly we need to do to be able to get the right answer. Most of the time, I just play it. I try to read the question before. I try to read the question and the options before listening to the reading, before listening to the audio voice. But from what you have explained, I could actually, quickly figure out the right thing to be done by knowing who is talking and who is the person talking to, what the patient need and what to do for the patient or any time and the setting, depending on the setting that is given. So I have learned to look at the question and then pick out the very important vital things in it that will allow you to know exactly what to pick as the best answer from your teaching. So I'll use this method in my subsequent practice. I believe it's going to help me so much. Thank you, sir.
Yeah, very good. Very good. Now, what you are supposed to do is just I have taught you one question. So, shall we go to question number 26? I want to see how many of you are interested. 26. Shall we continue with the next question or shall we go to part C? I'm already continuing. Part A finished. Part A1, first extract over. Part A, second extract over. Now we are going to part B. Now this one question is enough or shall we go some more questions? Yeah, I'm ready. No problem. We'll do full test also. But if anybody say, no, sir, no need. Now we'll go to part C like that. What is your suggestion? Do you think we have to know more about part B? Anyhow, I have no problem. I'm there full session today. I'm there full session today. Already told in the house. So all night I'll be working. So tomorrow morning, don't disturb me. So that's it. Now, if you are interested, we'll get a strong. If we do all the 6 questions, we'll get a strong basis, strong foundation, so that you will not shake. So, what do you say? Shall we continue with the 26? How many of you are interested? Say yes. Just in the chat box, say yes. Part B. Question 25. Listening. Yeah. So, very good. That's it. So far, 3 students have said, let's have 27. Yeah. Yes, sir, I will. 26, I mean, yes. Okay. Anuja, yes. Okay. So we are moving. Anu raised a hand. Anu. Yeah, Anu, tell me. Yes, Anu. Oh, you said yes, you raised hand means yes. Okay, okay. I understood. Do you want to speak anything? If you want to speak anything, you can unmute. So now we are going to the 26th question. We are going to the 26th question. We are going to the 26th question. Yeah. Yes, go through this question and try to analyze like I'm giving you 3 minutes. I'm giving you 3 minutes. Okay. You can write the question in your notebook and you can analyze. Then afterwards, I'll invite somebody to explain this one. Then I will explain. Okay. You can explain now, like how I'm telling. Okay. You can think about this one. Okay. So here, for example, just like that, I can tell. See how? See, for example, I'll give you one idea now. This is talking about other patients. This is talking about patient's family. And this is talking about patient's condition. So here it is patient. Here it is patient's family. And it is patient's other patients. So try to understand this. So the key word here is what? So others. Here family. Here patient. So in the first A, other patients problem. In second B, family is the problem. In third one, patient is the problem. See how I am easily making it out? The possibility of contagion amongst other patients. This is a patient, other patients also. So he's bothered about other patients, not this patient, not this patient's family, but other patients in the hospital. And risk to members of the patient's family. He's not talking about other patients, but he's talking about the family members. Family members. Family problem. Family in the hospital means other patients. Family problem in the family means patient's family. Patient's condition means patient. So in C, patient is the problem. In B, family may have problem. C, other patients may have problem. So here, what is the condition? For example, there is a case of chicken pox. So this patient has chicken pox. This patient has chicken pox, means family also might have chicken pox. Okay. Our family are taking care of chicken pox. So patient is already there. Patient already has problem, his condition. Now, this patient is already at risk. Problem to the patient. Because he has or she has chicken pox. Patient has chicken pox. So problem to the patient. Now, patient is in his family. So risk to members of his family. So he is going back to the family, or he is coming from the family, or he is in the family, or she is in the family. That means he has chicken pox, so family members also may get chicken pox. So B, problem of chicken pox to the family. C, problem of chicken pox to the patient. B, problem of chicken pox to the family, patient's family. It's going to the second line. Then A, possible of contagion. Contagion means chicken pox amongst other patients. Other patients means what? Not patient, not patient's family, but other patients. So there is a risk, there is a problem of chicken pox to other patients if this patient is there. So remember that. So if patient has problem. Second one, patient is in the family or patient is with the family members will get chicken pox. A patient is in the hospital, okay? Other patients may get chicken pox. So what is the problem here? Who has the problem? Patient has the problem, or patient's family has the problem, or other patients will have the problem, may have problem. because of this patient. So chicken pox is only to the patient already. So that's finished. Now this may affect the family members. So extend it to family. Okay, then afterwards, it may extend to the other patients in the hospital if she is admitted in the hospital. Other patients may get chicken pox. So that's what it is. So you know that one. A risk, a possibility of contagion. Contagion means what? Spread, fast, widespread disease, contagion. Contagious disease, contagious means spread from one person to another person through air, water, or touch. Contagious disease. Contagious disease means through contact from one person to another person through air or water or anything. Okay, touch. So that's it. So first hand problem is patient. Patient is first hand problem. So he already has chicken pox. This is increasing. So they are discussing about the severity of patient's condition. So problem, severe problem for the patient. So it's a problem, patient's problem. See, next one. Now he is in the family, he is with the family, or he is staying with the family. Then family members also will get this disease. So risk to members of the patient family. Maybe father already got, maybe other children or their children may get chickenpox. So other members like father, mother, brother, sister. So A. Now family already knows that they have the boy has chickenpox. So they are taking precautions already. So there is no risk to the family members because they are taking care. They are taking protection. They are comfortable. They are staying away. They are putting masks. They are doing not touching her. They are trying to help her in every way, but they are safe zone. So no risk. But there are other patients. Okay. There are other patients in the hospital. Maybe she is in the hospital. We have to know where she is. So she is in the surgery. Remember that. She is in the surgery. You hear two nurses in a GP surgery discussing a case of chickenpox. She is in the surgery, not at home. Not at home. She is in the surgery. So now in the surgery, in the inpatient department, okay, others may contract this chickenpox because it's a contagious disease, maybe through air or through touch. Somehow it may spread. So a problem for the patients, other patients. So remember that. Now here, what will they speak? They are both concerned, both, not one, both concerned. What are they both concerned? One may be concerned about the patient's condition. Another one may be nurse A, that means male nurse, may be concerned about the patient's condition. Nurse B, that means female nurse, she may be saying family may be affected. But both should say, not one. So here, three may be right. They are talking, three of them are talking. Three of them are discussing. 3 points they are discussing. Okay. One patient, one nurse may say, oh, the patient's condition is very severe. Then the second one nurse says, no, I don't think so. Because now she is with us, doctor has already, so doctor can manage. So second nurse is saying no. First nurse is worried about the patient's condition, but second nurse, senior nurse says no, there's not going to be any problem because it is well managed till now, and now the doctor will give treatment and he will make it perfect. So no problem. So when the second nurse says against that point, against that concern, she's saying no. First one is telling yes, second one is saying no. So C is ruled out, suppose. Then B, after talking to that, second nurse will say, lady nurse will say like this, No, she's not. I'm not worried about the patient's severity of the condition, because whatever severe condition, our doctor is very strong. He can manage, and manageable condition only, no problem at all. It's not that severe like how much you are thinking. After saying, contradicting with her patient's condition, she will continue. I am worried about the patient's family. Maybe they also have this one. No, no, no. Then the first nurse will say, no, no, no. We have already checked them. They are not affected with chicken pox. There is no risk for them, because they are taking safety measures and they have good education and they are taking proper precaution not to get chicken pox. So first one is countering. Then the third one, then again she will say, yeah, now they are in the hospital, they are admitted. What about the others? What about the other patients? Now I am worried about, yeah, I also am worried about that. So both of them say yes. Then only both should be concerned about that. Both should say yes. Yes, they have a problem. So both of them should agree with the patient's concern, patient's risk, or the family's risk, or the patient's risk. Patient's risk or family's risk or other patient's risk. Both should say yes, it is risky for. Then only it is right. Both should accept. Okay, this is the most important word. Both should accept. There are two nurses, nurse 1 and nurse 2. Now see the relationship here, nurse 1 and nurse 2. Okay, nurse 1 says problem with the patient's condition. Nurse 2 says problem with the family, but both say problem with other patients. Now see here. Now which is the right answer? A will be right answer, like this. So this is the way how you have to measure. Both should be saying yes. Both. That means what? Both means what? Nurse A also says problem with other patients. Nurse B also says. So both of them should agree about the concern. Both should accept one another. Yes, yes, yes. Both should say. Then if one says yes and the other says no, that's not accepted. If second says yes and the first says no, that is also not accepted. Both say, first one, A says, nurse A says, there's a problem, and nurse B says, yeah, I agree. That means the answer is right. So this right, both should be agreeing regarding the patient's problem or the family's problem or other patient's problem. So both should agree. I hope you understand what I am telling. So in simple terms, I have told you. In simple terms, I have to Anuja, Anu, Dinusha, Dinusha, Odion. Who is missing? Who is missing? Okay, fine. So this is the way how you have to understand. Both. Both should be concerned. Concerned about what? Risk. Okay. All about risk. Concern. Concern means what? Worried. Worried about what? Problem. Problem is what? Risk. Okay. Yes. So both concerned. Concerned means worry. Concerned means worry. So chicken pox. Concerned about. So concerned about what or whom? So are they worried about the patient? Both. Are they worried about the patient's family? Or are they worried about the others, other patients? Others. So patient, family, and others. That's it. So you have to focus on this one. So everything concerned about the risk. So the problem is risk. So who is at risk? Both of them agree. Who is at risk? That both of them agree. So patient's risk, family's risk, others' risk. Others' risk means A, family risk means B, patient's risk means C. That's it. Severity means risk. Possibility of contagion means risk. Risk to the members means risk. So everywhere it is risk. The common word is risk. Concern means some problem. Problem means risk. Okay. So that's how it goes. So is that clear, all of you? Clear. Is that clear? Just message, is that clear? If you say yes, we can move forward. Otherwise, if you have doubts, you can ask me. Print the screen. Yeah. Question 26. Yeah. So clear. Very good. So simple. You have to see how it is dividing. The possibility of contagion means chickenpox among other patients. The risks of chickenpox to members of the patient's family. The severity of chickenpox of the patient's condition. So patient, patient's family, other patients. So patients, family, public. Anyway, you can write. Okay, so simple. So we'll move to the next question. Yeah, this is the 27th question. Just to go through this. Yeah. Go through this and analyze like the same manner. I'll just prepare some tea. Oh. Yeah. So here you have the 27th question. Now, what you have to notice first, you hear an anesthetist talking to a patient. So, two people are there, anesthetist and patient. And now, what is she doing? So, she is the anesthetist. She is the anesthetist. So, patient is he now. So, he's a male, he. Okay. You have to understand that very clearly. The patient is he. So there's a female voice, there's a male voice. What is she doing? Doing means action in progress. Doing means action in progress. So think about that one. Action in progress. What is she doing? What is she doing now? Now means at this time. At the time where they are discussing, what is she doing? Is she explaining? What do you mean by explaining? Explaining something which the other person knows but doesn't know in depth. So explaining means deeply, like how I am explaining. Explaining means deeply, like how I am explaining step by step in detail. Detailed explanation. Next one, confirming. Confirming means something we already know and we are confirming that. Something we already know and we are confirming. Confirming. So I don't know what happened there. So I know something, I doubt something. For example, what happened? So, for example, um, you know, for example, let me tell you, somebody has cold. Somebody has cold. So the doctor will ask the patient, okay, what do you eat too much ice creams? Then that is a doubt. Now the patient will confirm, yes, I eat too much ice cream. So that is called confirmation. What the doubt will be confirmed by the other person. That is confirmation. Advising. Advising means the other person doesn't know anything. So he has some confusion. What to do? Do this or do that. Then you advise him to do something better, like that one. Okay. So explaining, confirming, advising. That's the difference in meaning here. So there are three words here. One second, my what T. So explaining. Explaining means somebody knows 10%, you are explaining 100% or 70% or 75%. So little they know, more you are explaining. They have a small idea. See, for example, you know how to do listening, but you don't know much. So I'm explaining too much in depth. That is called explaining. Explaining means a more knowledgeable person teaching or telling somebody who has less knowledge about that person, giving more knowledge. So giving more knowledge is called explanation. Then next one, confirming. Other person has a doubt and you are confirming, yes, that is right. That's it. The third one is advising. Advising means the other person doesn't know what to do, so you will tell him which is the best. One second. Now think about the other options. Yeah. So explaining why he must stop. See, he. So who is this he? The patient. Who is this he? The patient. advising him to discuss his concerns. So this is all about the patient. Okay. So these will show that the patient, so whose words you have to focus, not the patient's words, you have to focus on the anesthetist's words, because she is explaining, or she is confirming, or she is advising. You have to focus on, not on the patient's words, you have to focus on the lady's voice. She, remember that. So explaining why he must stop his regular medication. So stop the medication. So stop the medication. Medication is a problem. Medication is a problem because he is going for surgery. If he takes medication, there is some problem. There is some problem with medication. There is some problem with medication. So she is telling him, stop the medication. Then you will ask why. Then he is explaining. Okay. He is giving more knowledge because the other person doesn't have that much knowledge. Right? The next one, confirming a previous adverse reaction. Previous reaction. So past experience. Previous adverse reaction he experienced. So this is about previous experience. Adverse reaction. This is the past. Okay. Adverse reaction. This is about a reaction. So reaction is a problem. Past, he had a reaction with the medication. So everyone cannot take penicillin. There is side effects of penicillin if some people take. So that is a problem. So adverse reaction. Adverse means side effects. Previous adverse reaction he experienced. Okay. So anesthetic is talking to the patient. Okay. So first one, medication should be stopped before surgery. Second one, previous adverse reaction he experienced. Who? The patient. So the nurse is explaining, yes, that's right. That was an adverse reaction. So I agree with that. So that is confirming. Right. Next one, advising him to discuss his concerns with the surgeon. So here he has some concerns. He has some concerns. So he has to discuss with the surgeon. Okay. He has to discuss with his surgeon. So try to understand this one. So medication, reaction, and concerns. Right? Medication, reaction, and here you can take surgeon also. So what is the problem? Medication is the problem. Because he is going to surgery, he should stop all the medications because there may be side effects. Number two, he had some adverse reaction in the past. He had some adverse reaction in the past. So the anesthetist is confirming, okay? It's confirming a previous adverse reaction this patient experienced. Yes, you are right. That was what happened earlier. It was an adverse reaction. So better we don't take that medication. We'll take something else. That's the point. So confirming a previous adverse reaction. The next one, advising him to discuss his concerns with surgeon. So he himself has some concerns. Who has concerns? Patient has. So patient is the problem. Patient itself is the problem. So first one, medication is the problem. The second one, previous reaction is the problem. Third one, the patient himself is a problem because he has some concerns. So he has to discuss with the surgeon. Surgeon is not the problem. Okay. Surgeon is the solution. Surgeon is the solution. So patient himself is the problem. First one, medication is the problem. Second one, reaction is the problem. Third one, the patient himself, his doubts are the problem. Okay. So focus on these three things. What's the first one? Medication. Medication. So medication is the problem. So you have to stop the medication because you are going to a surgery. Second one, this is next. Reaction. This is past. That is future. This is past. So in the past, previous means past. Reaction. He had a reaction when he took some medication or something. He had some adverse reaction in the past. He experienced. Okay. So experienced. Negative reaction or adverse reaction. So better not to take that reaction, medication, which is reactive. So problematic. So reaction is the problem. The next one. Third one. Advising him to discuss his concerns with the surgeon. So he has some questions. He has some doubts. So he is confused. He is anxious and worried. So he is concerned. So the anesthetist is telling, I cannot tell you all those things. So you have to talk with your surgeon. So his doubts are the problem. First one, medication is the problem. Second one, reaction is the problem. Third one, adverse reaction is the problem. Third one, his doubts or his concerns, the problem. So third one is concerns, worries, issues, his confusion, his doubts. Here, concerns means doubts. So what is she doing? Is she explaining why he should stop his regular medication before going to surgery? So focus on medication. Okay. Second one, past. She had a bitter experience with some medication or some drug or something. Yeah, that medication has some problem. Yes, I agree with that. So we'll not take that one. For example, penicillin. Madam, last time I took penicillin, so I faced some itchy sensation and there was some redness when I took that penicillin, and I was little upset. No. Then the anesthetist said, yes, penicillin has some side effects. 5%, 1% of the people or 2% of the people may have side effects, or 1 in 1,000 has side effects. So that is confirming, yes, you are right. Then that is confirming, yes, you are right. This medication or this drug has a negative effect for some people because that medication is not accepted by this person's body or something like that. So there is a negative reaction. So I agree with what you are saying. That is possible. That is possible. And yes, I agree with you. Something like that, she said, that is confirming the adverse reaction he experienced earlier. Then advising him to discuss his concerns with the surgeon. So here, she cannot do anything. She is helpless. Who? The anesthetist. So his doubts are beyond her capacity. His doubts are beyond his capacity. She is not an expert. So she is telling, ask the surgeon. He will tell you the solutions. It is out of my reach, out of my bound. It is not my cup of tea. I cannot explain your doubts clearly. That doesn't fit my knowledge. My knowledge is not sufficient. So who is doing your surgery? Surgeon. So you better go and talk with him. I'll fix an appointment. You can talk with him for 5 to 10 minutes or even 15 minutes before you go to the surgery. That's all. So the important words are medication, reaction, concern. Not explaining, confirming, advising. They are not important. Medication is the problem. Okay. Reaction, negative reaction is the problem. His doubts are the problem. So without his doubts clarified, he cannot go to surgery. That's it. So question number 27. Question number 27. So question 27. Is that clear? Yeah, message first. Since he is back, Ruvini is back. Wow, very good. Hello, Ruvini. Where did you go, my dear?
Hello, sir.
Hello, dear. I missed you. Where did you go?
I'm not
So I'm a
going.
bad teacher. I know that one. I teach long sessions. I teach too much. But you should be good student, no? Huh?
Yeah.
I'm a bad teacher. You
No,
should be good student. Huh?
both
That's
are
it.
good.
Why you no? I say you are not good now. You are missing my classes. What to do? Huh? You say my exam is on the 15th, and you people, you and this Cincy, both of you said, Sir, our exam, morning you started, and I am continuing, and both of you are missing. Lovely too, huh? Hmm?
We are
Yeah,
back,
tell
sir.
me. So did you understand this question? Just now you started, or did you attend this full question? 26.
At attend this full correction, sir.
Ah.
It's clear now.
It's clear now. But you
Yeah.
missed your 25 and 26. Afterwards, go watch. I'll send you the video. You go watch
Oh,
afterwards, okay?
all right. Thank you, sir.
Right. Yeah. Cincy. Cincy.
Sir,
You are hands in gloves, no? Both of you? Huh? Hand in hand, you are escaping my classes, no?
no, sir, I went to the pick up my son
You
from
went to pick up your son.
yes.
Okay. Did all these guys give chocolates to my friends? I'm angry with all of you. I told all of you give chocolates to my friends, no? Did you give?
Mm.
Not even one person will give, I know. Very good people, very good people, very good people you are. I blessed you so much and you can't give chocolates to my friends, huh? Very bad. No, I'm very sad. I won't talk with you, cutty with you. Yeah, tell me, Cincy, how was the session? Did you attend this 27th question?
Yes, sir. Now, yes.
Hmm. Yeah, very good, very good. So all of you, did you understand the session? Type yes. Because I'll not unmute everyone every time. I told you, no, now I'm moving very fast. We have to finish part C also. Yeah. So next we'll go to 28, question number 28. Ho, 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 ho. Question 27. Yeah. Yes, go through this question number 28. Go through this question number 28. Question number 28. Study this question. Go through it for 2-3 minutes. Then we'll discuss. Yeah. Yes. You hear a woman telling a practice nurse about her son's ear condition. You hear a woman telling a practice nurse about her son's ear condition. What is she most concerned? Most concerned. So, now here, a woman telling. So this is a woman telling the practice nurse. So practice nurse is male. Practice nurse is male, he. And a woman, she. Practice nurse is he. And a woman, she. So she. She. Yeah. Woman, she. What is she most concerned about? So she is more, she is concerned, she is more concerned, she is most concerned. She is concerned about all the three maybe. But most concerned, most, superlative degree. She may say, I'm not worried about, I'm little bit worried about, I'm highly worried about, highly, extremely, too much. Such words you have to listen. So she's concerned. Concerned means worried, anxious, upset. Okay. Tensed. She's stressed about what? About something. What is that something? So she is stressed about something. She is stressed about what? About what? What is that? What is that? What is about what? About that. About that. About that. Now, concerned about that. What is that? So, what is that? What is that? What is that? That something. That is something. That is something. What is that? That is something. What is that something? What is that something? Okay. What is that? That is something. This something is hearing, or something is medicine, or something is surgery. Okay. So hearing. So she is concerned about hearing. Can he hear or not? The effects on her son's hearing. Can he hear properly or not? Can he hear or not? Can he hear problem? Can he hear or not? Can he hear properly or not? So hearing is the problem. Hearing is the problem. The use of certain medicines. So she is worried about medicines. Should I use this medicine? Why should you use this medicine? What is the benefit of this medicine? So she is asking like that. Then B is the answer. The prospect. Why do I need surgery for my son? What is the use? Is there no other option? Why am more worried about? What upsets me the most is I know that I have to take some medicines. I accept that. But I'm little bit bothered about my son's hearing. But why surgery? What is the use? That's what I'm not able to understand. So she's most concerned about surgery, like that. So try to understand superlative degree, the topmost concern. All three she is concerned, maybe. So you have to see which is most concerned. Concerned, more concerned, most concerned, not concerned. If she is not concerned, that is not an answer. Little concerned, that is also not concerned. More concerned, also no. The most concerned, highest degree. The highest degree of worry is about I am least bothered, means not bothered, not concerned. I'm extremely bothered about why should we do surgery? So that is highest concern. The most bothered, extremely bothered. Extremely means most, highest. So try to understand. So you have to see that superlative, the highest, worries me the most. The biggest concern is that which upsets me to the largest degree, like that. So you have to understand that most, much, more, most. Much, more, most means concerned, more concerned, most concerned. Try to understand. That is superlative degree. Much, more, most. Most is the top. She is the most beautiful. Kashmir is the most beautiful place in the world. Most beautiful means topmost. Okay, topmost. So that level. Fine. You have to check. You have to guess. So she might be concerned about all the three things. She is concerned about what? She is concerned about hearing. She is concerned about medicines. All three also may be right. But which is the most concerned? All three are right. She is concerned about hearing. She is concerned about medicines. She is concerned about surgery. But which is the most troubling thing? Okay. I know my son's ear condition. Okay. I know he can hear. But the problem is with medicines and surgery. Medicines, okay. I can give the medicines. But what is the need of surgery? Why should I send him for surgery? Tell me the reasons. That bothers me a lot. So this is the way how you have to listen. Then you can understand. Then you can understand. The highest degree. Most means the highest degree. Much, more, most. Good, better, best. Tall, taller, tallest. High, higher, highest. Big, bigger, biggest. Less, lesser, least. I am least bothered. Means not at all bothered. Okay. But I am extremely worried. So extremely means extreme to 100%. Extreme means border, topmost, extreme, 100%. Bothered about. Bothered means concerned. Another word may come. Concerned, worried, bothered, upset. What really upsets me is then surgery. What is the advantage of surgery? That's it. Why should I send my son for surgery? I'm a little scared. That's what it is. See, she will speak like this. I hope you understand. Who is another one who came just now? Sinsi, Ruvini, Odio, Dunisha, Dinusha, Anu, Anuja. Okay, fine. So that's how it goes. Yeah. So, question 28. Okay. Let me know if it is clear. Oh. Question number 29. You go through this. If anybody has doubts, you can write down so that I'll go a second go. Otherwise, we'll go to question number 29. Yeah. Very good. Thank you for responding. I need this response. See, I explained for 10-15 minutes, at least one sentence. Okay. So that for you only I'm asking. So respond. Don't be lazy. Huh? Yeah. Question number 29. Go through this. Question number 29. Go through this. Yeah. Take 5 minutes, no problem. I'm enjoying my tea. So you hear an ENT consultant. You hear an ENT consultant describing a recent cancer case he was involved in. He is describing to whom? No, to the public. A recent cancer case he was involved in. A recent cancer case. So it is a monologue. Only one person is speaking. There is no second person. He was involved in personal experience. The unusual thing. So usual things, unusual things. So what are the synonyms of usual? Usual, common, regular, normal, general. So these are the synonyms. So you have to know synonyms of these words. Step by step, every time new one I will explain, okay? So usual, common, normal, regular, general, usual, common, normal, general, regular. The opposites of these are usual, common, normal, regular, general, usual, common, normal, regular, general. Okay. Now the opposites of these are unusual, uncommon, abnormal, irregular, special, and general, particular. So unusual, uncommon. Uncommon means rare. Okay. Common, rare. Usual, unusual. Normal, abnormal. It's not normal. Regular, irregular. General, particular, or specific. Specific. So these are the words. So these words, anything not usual, not common, not normal, not regular, not general, that also is another style. Okay. Right. Now let us see. So recent cancer case. You hear an ear, nose and throat, ENT concern describing a recent cancer case he was involved in. He means male person. So male person. So unusual. So this is called reading between the lines. The unusual thing about the case was, so usual thing, common, this is general, this is regular, this is okay, normal, all those things. But what is unusual, not so common, something special, something special. So specific, special, ordinary. Yeah, another word is ordinary, special. Usual means ordinary. Another word is ordinary. See, like this, words will come like that. Ordinary means usual. Here it is special. Okay. Or ordinary, extraordinary. Special or extraordinary. So they will play with the words. See how many options are there. You also know all these things, but you cannot relate. Why? Because you don't think them as a together. You read them as individual words. You read them as in usual, common, normal, regular, general, ordinary. Oh, all are same. All are same. No difference. Opposite of them are unusual, uncommon, rare, abnormal, irregular, particular, specific, special, extraordinary. This is different. This is opposite. All are same. Uncommon means rare. Unusual. Not usual. Same. Okay. So, be very careful. You should know the power of synonyms. Note these down. Note these down. They all mean one and the same in a little bit different style. Okay. So any word from these two groups can be used here in the audio. Any word can be used because there are three options. For each option, different words may be used. So be careful. Right? He may say the opposite or say not. Okay. Usual, not usual, unusual. Anything he may say. Right. Shrinkage of the tumor occurring relatively quickly. So, this is cancer. Tumor, normal. Okay, shrinkage. Shrinkage means reduction. Reduction. Minimizing. Okay. Decreasing. Deteriorating. Okay. Next one. This is tumor. Shrinkage of the tumor. Then bone erosion. Bone erosion. So bone erosion, shrinkage of tumor, bone erosion, CSF leakage. CSF. What is the CSF? Anybody knows? What is CSF? Cerebrospinal fluid. I think you know it. How many of you know this one, what I have told? CSF, cerebrospinal fluid. I also did not remember, just when I thought I got it. Okay, leakage. Leakage means liquid or fluid. So fluid. So what fluid? CSF, C cardio cerebro. So cerebrospinal fluid. CSF. Leakage. So fluid is leaking. Okay. So what is it talking about? Unusual thing. What is unusual? What is unusual here? Yeah, welcome, Zubi. What is unusual here? Shrinkage of the tumor. So tumor is a shrinking in size, means reducing in size. Earlier tumor was big, 12 mm. Now tumor is 3 mm. Very fast, relatively quickly. I did not expect, but that reduced. So shrinkage, minimizing in size, minimizing in size. This is about the tumor. Second one, bone erosion not showing up immediately on the scans. Bone erosion. Erosion means what? The upper layer going off is called erosion. Soil erosion means, see, when storms, floods, winds come, the upper layer of the sand, earth, upper layer will be driven away by the wind. That is called soil erosion. Means soil will be washed away. For example, rain. When rain comes, what happens? The upper layer of the earth, it will be washed away in the floods. So it will be washed away gradually from the mountain tops into the rivers, into the ocean. So that is called erosion. Erosion. For example, you see, you go to the seas. You see, by the side of the sea, there will be some rocks, mountains like rocks, rocky beaches. You see, by the side of rocky beaches, you see there is rock erosion. That means the rock is wiped away by water. Okay, and in some mountains, you see the wind blowing. So the wind blows the mountains, rock erosion, mountains. The layer will be wiped out, okay, because of the wind, heavy wind, right? So erosion means withering away or removing the uppermost layer. That is called erosion. Bone erosion means bone, the upper layer will be eroded or removed. The topmost layer will be removed. For example, skin. For example, when you have a bruise, the upper layer of the skin is scraped away, scraped. And you can see the red part, red part. Skin is white or brown or wheatish or whatever color you think, that's different. But when the skin is bruised, when you fall down, the skin is bruised and the upper layer is scraped, okay, and the skin comes off, upper layer, epidermis comes off, then the mesodermis is visible, red, and blood also, okay, that is called skin erosion, right? In the same way, the topmost layer, if it is removed from the rest of the layers, it is called erosion. So bone erosion. So he's talking about bones, okay, bones and erosion. Then leakage. Leakage, it's leaking. First one, it is shrinking. Second one is withering away. First one is reducing in size. Second one also reducing in size. Third one also reducing in size. Shrinkage means from bigger size to smaller size. Erosion. Erosion means what? So the upper layer is removed from the remaining layers and separated and it is washed away. That is erosion. Third one, leakage, which should be contained in the vessel, blood vessel or the tube, spinal cord or brain, whatever it is, that fluid, because there is a leak, it comes out. That also reduced. Everything is reduced only. Shrinkage means shrink in size. Erosion means separating from the main part. Leaking means also coming out of the container. Everywhere it is reduced only. But see, first one is shrinkage means size reduced. Erosion means layer removed. Leakage means amount or quantity reduced. Coming out totally out of the container. That's it. So first one he is talking about tumor. I'll change the color here to blue. Second one, first one is talking about tumor. Cancer case, recent cancer case. So is he talking about the tumor? So tumor, right? That's muscle part or something fleshy part. Then this is regarding bone tumor, bone cancer. So bone erosion. Try to understand the thinker, how you have to think, read between the lines. Read between the lines. So first one is about tumor shrinkage, that means flesh part. Second one is bone part. Third one is fluid part. This is not flesh, this is not bone, this is fluid or liquid which is in the body. It is leaking from the spinal cord. Somewhere some damage broke or something and separated or gap has come. From that spinal fluid is coming out. Like, that, what do you call, mothers when they give birth, the womb inside explodes and the water, we call that water something fluid, that amniotic fluid. Okay, amniotic fluid, that will be come out, burst and come out. So child will face suffocation. Okay, so like that one, that leakage happens. Somewhere some breakdown. So what is breakdown of amniotic fluid. In the same way here also, leakage, some cells, for example, blood cells burst, blood leaks within the body, internal bleeding we say, internal bleeding inside the body. We don't even know. And because of that, there is too much problem, internal bleeding. So in the same way, internal bleeding, this is also one type of internal bleeding where the cerebrospinal fluid, cerebrum to spine, which holds the spinal cord together strong and passes on messages from the brain to the nerves and nerve cells called neurons. So that fluid will be carried from brain to the entire spinal cord tip. From there onwards, from the spinal cord, the nerves will take to the neurons and every body part. So that is leakage, that is leaking. Then a terrible damage, the messages to be passed will be difficult. So blood goes from one part to the part. What is the use of blood? Blood is a carrier of oxygen, carrier of carbon dioxide, carrier of proteins, lipids, salt, sugar, everything. Through blood only it is carried to all. Blood is practically nothing benefit, but blood is a carrier. The things which are carried by the blood are a lot benefit to the body. Okay, that's it. Purified air, important. The ingredients we eat, the vitamins, everything is carried through blood. So blood is very, very important. Okay. So that cerebrospinal fluid is leaking here. So the amount, how much should be there, is reduced. So everywhere it is reduced. So is he talking about what is unusual in this case? Is he? What is unusual here? The tumor decreasing in size is unusual, or the bone erosion not shown on the scans is unusual. CF leakage being detected so long after the first operation, which is. So now, shrinkage of tumor will shrink, that is common. Bone erosion, bone will erode, that is common. CSF leakage, that is also common. But what is uncommon? One of these three things. Tumor occurring relatively quickly. It should take at least 2 weeks, but within 2 days it reduced. How is it possible? It should take long time, na? Tumor should shrink, should take a long time. It will not happen overnight. Why so fast it happened? That is unusual. So shrinkage of the tumor will take at least 3 to 4 weeks, suppose, when you're taking medication or something. So what happens? What happens here? So 2 to 3 weeks is a long time. Of course, that is common. For every tumor to shrink to half its size, it will take 3 weeks. But if it is reduced to half the size in just 3 days, it is uncommon. Common, uncommon. One is common. If it is not common, then it is uncommon. So normally, how much time will it take to shrink? Tumor to shrink? To become reduced to 50%? 3 weeks. So if it is 3 weeks, common. If it is done in 3 days, it's uncommon. 1 week, uncommon. 1.5 weeks, that is also uncommon because it normally takes 3 weeks. Why 1.5 weeks? Why 1 week? Why 3 days? So that is uncommon. In the same way, bone erosion not showing up immediately on the scans. Now, bone erosion, yeah. So upper layer of the bone is eroded. It's washed away, melted and washed away because of cancer. Now, this erosion, when you take scans, it is not showing up immediately. It is eroding, but it is not showing on the scans. Scanning is not able to detect. Scanning is not able to detect immediately. It is taking time. Why? So bone erosion happens. For example, weekly, it is eroding. But in the first week, or in the first 2 days, or 3 days, or 1 week, it is not detecting on the scans. But after 2-3 weeks, maybe 4 weeks, it is getting detected. So when it erodes, immediately it should be detected. But why it is not showing up immediately? It should be shown up within 2-3 days. It should be shown. But the scans are not able to detect that. They are not showing up on scans. Why? Then when it is showing, maybe after 4 weeks, the bone eroding. After 4 weeks only we are able to take the scans. The erosion is seen clearly. Otherwise it is not seen. It's not noticed. That's what. So bone erosion showing immediately on the scans, that means within 1 day or 2 days, then that is good. That's common. That's normal. That's usual. That's regular. That's general. That's ordinary. But if it shows after 2 weeks or 3 weeks or 4 weeks, that is unusual, uncommon, rare, abnormal, irregular, particular, specific, special, and extraordinary. Right. Next one, CSF leakage being detected so long after the first operation. So CSF leakage, operation is done, completed. Surgery is done, operation is done. So first operation is done. But if CSF leakage is detected, it should be detected immediately after the first operation. Immediately. If any leakage is there, within hours, it should be shown. But this CSF leakage is being detected maybe 3 days, 4 days, 5 days after the operation. Immediately after the operation, within 1 hour, it should be detected. But why is it not detected within 1 hour, 2 hours? If something is wrong in the operation, something broke down, and there is some leakage, there is some damage in the cerebrospinal fluid containing a spine, some damage is there, then immediately that should be noticed. Immediately after the first operation, it should be noticed. So try to understand that. But what happened? It was not detected immediately hours after the first operation. It took days, it took weeks. Maybe after 1 week it is defective. How is it possible? Why so late? That's unusual. Normally, it is detected immediately after the first operation. Maybe within a day. But here, After a week, it is being detected. So long after the first operation. Why was it not detected earlier? It should have been detected on the first day itself. If missed the second day, but after 1 week, no, this is not normal. There's something wrong in it. Yeah. Usual means right. Unusual means wrong. That's it. That's not right. Right, wrong. That's not right means wrong. That's not ordinary. That's unusual. So try to understand this one very clearly. Okay. Tumor occurring relatively quickly. Tumor should not occur. The shrinkage should not occur quickly. It should take time. Okay. Bone erosion not showing up immediately on the scan. It should show, but it is not showing. That's the wrong. CSF leakage being detected so long after immediately after the first observation, it should be detected. But why it was not detected? So that's not fine. That's not fine. That's not common. Okay. So what is wrong that you have to notice? Okay. So there goes your question number 29. Reason. Try to understand very clearly. Try to understand very clearly. That's very important. Yeah. So, right. So, now, question 29. Clear? Yeah. Message if it is clear or not. That is 28. I did not put 29. 28. What happened? Oof. So this should be 28. 28. This is 29. Yeah. Afterwards, I'll put question number 28. Yes, please respond. Nuja, Anu, Sinsi, Odion. Yeah, those who started late today, who are they? Yes. Yes. So, yeah. Ruvini, you joined late. Yeah, tell me, did you understand this one?
Yes, sir.
Why? What new things you have learned today?
Mm, New thing is key point. I know now how to select the key point
Mm.
and yeah, tally with the question.
Mm. Yeah, very
Yes, sir.
good. Next, Cincy.
Yes.
Cincy. Yeah, share your experience. What did you
Uh,
learn?
yes, sir. Actually, today I understand how to pick the key point. Before, actually, I read the question and read the answers and listen to the uh, audios, and after that get the answer. But I know today I know how. Firstly, we have to select the key point, and we can think the what is the answer here.
Yeah, that's good. Zubi. Zubi. Yeah, you can unmute and you can share your experience. What did you learn? How was it beneficial for you? You are a guest. It's our honor today. Can you share your words if you don't mind? Okay, if you're not comfortable, you can just write a message there. Okay, next. Question number 30. Go through this question. This is a simple question. This is a very simple question. So you hear a surgeon and an anesthetic briefing their team before an operation. So there are two people here, a surgeon and an anesthetic. They are briefing their team before an operation. Before an operation. They point out that post-operative care may be complicated by the patients. So post-operative care may be complicated, maybe future, by the patients. What? Poor respiratory health. So respiration is the problem. Previous surgical history, previous surgery is a problem. Okay. Problems with blood clotting. Blood clotting. So these are the three problems. So post-operative care may be complicated by patients. So what is the reason? What is the problem? Why his post-operative care may be complicated? What is the reason? What is the reason? Because of, due to, on account of. Okay. His poor respiratory health. Respiratory health. So breathing, respiration, inhalation and exhalation, taking in oxygen and giving out carbon dioxide. Poor respiratory health. So he is not able to breathe properly like a normal human being. So he has breathing problems. Breathing problems. Okay. The next one. Previous surgical history. So now they are going for an operation. Okay. They're going for an operation. But he had an operation earlier. Because of that earlier operation, post-operative care may be complicated. Here, prior operation, not this operation, prior operation. This is going to be the second operation. Okay, previous surgical history. The next one, problems with blood clotting. So blood clots. Because of this blood clot, post-operative care will be difficult. So whenever there is blood clot, something should be done immediately. So if there is no blood clot, so once or twice in a day or thrice in a day, you can support him. But if there is blood clot, maybe every time you have to be very careful. Suddenly any blood clot is there. So what happened? What is the difficulty? What are the signs, symptoms? So they have to rush to the hospital, or they have to ask the doctor, or they have to give the medication or something. So problems with blood clotting. So respiration is a problem, breathing problem. Previous surgical history, that will complicate the post-operative care. Earlier surgery, previous, past. Then problems with blood clotting. So first one is problem with, breathing. Second one is problem with surgery. Third one is problem with blood. So breathing, surgery, and blood. So try to see which is going to complicate. Okay, what is the reason why post-operative care may be complicated? Not sure, but may be complicated. What does the surgeon say and what does the anesthetist say? So that's how you have to focus here. So there are only three words, so easy to find out which is the most important word. Poor respiratory health. So it is respiration. Previous surgical history, surgery, surgical. Okay. So problems with blood clotting inside, internal. Okay, internal. So try to understand how these three words are related and which of these is going to complicate his post-operative care. Okay, focus on these words. If you focus on these words, it will be very easy for you. Now you can listen to the audio and you can do the answers like this. But first, try to understand very clearly. Try to understand why something is going wrong. try to understand how to identify the most important words. That's the name of the game. Yeah. Question 30. Yes, that is question 30. Focus. Yeah. Print screen. Question number 28. Yeah. I missed this question number 28. Twenty 28. Yeah, question number 28. So 25, 25, 26, 27, 28, 29, 30. Yeah, that's good. So how many of you got it clear? How many of you got it clear? So 30 questions. So are you ready for part C? How many of you are ready for part C? Write down your name. Or just say yes. Dinusha, Dunisha. What about the others? Are you tired? This old man is not tired, and you are tired or what? Sinsi, yes, sir. Odeon, yes, sir. 1, 2, 3, 4. Very good. Very good. Anuja, yes, sir. Okay, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. What about the others? Others are sleeping already? Huh? Good. Good, good, good. Yeah. Now, yes. Yeah, Anuja. Part B. Part B. Anuja. You're all my regular students. You have paid the fees and you are learning. So, is the sessions you take are worth? Part B. Is it simple now? Is it becoming easy now? Part B. Are you able to understand the different styles of attending Part B questions? What is the modality? What are the modes of answering the question? Okay, what are the techniques, strategies, and tricks you have to use? What are the different tips you learned? So whatever you want to speak, I'm giving you 2 minutes. Come on, fast.
Yes, sir, I think before I don't have such experience, sir. Now I know how to analyze the question and how to analyze the answers as well. Thank you very much, sir.
Very good, very good. Next, Anurudhika.
Yes, sir.
Mm.
It's good, sir. Actually, I don't have that much experience when I analyzing the questions, but most of the time I analyzing a lot of keywords. Now I can really understand what are the specific keywords. Then it's much helpful for sir. Thank
Yeah,
you.
pass on the message to your friends, like how Dunisha is telling everyone. Okay, Dunisha has brought so many students. You know why? Because she wants other friends to learn. She likes you very much. So like that, she passed on the message to everyone. She is the beginner, Dunisha.
Yes, sir. Yes,
So
sir.
you also can pass on. See, it's not, see, I am 55 years old. I'm not bothered about money here. I'm not bothered. I'm bothered about doing something which, see, this is night. What is the time, now? The time is here in India. The time is, where is the computer? The
2:30,
time is
sir.
2:35. 2:35 Indian time. Who will teach from India at 2:35? Huh? Correct? Yes or no? And that too at your personal time like this, after duty hours. So
Yeah.
let all your friends be blessed. Pass on the message. Pass on the message. Okay. So let them also benefit. Let them also be blessed. So you share this message and ask them to send our links and ask them to come and join. Tell them.
Yes, sir. Sure. I will
Okay.
share with
So
them.
now 15th, one more batch is going for exam. So there are 7 students going off for exam on 15th. So we are going to get some places. So by that time, they can register for the next batch. If anybody is interested, tell your friends, pass on. Huh? Pass on to your friends so that they can come and join for the next batch. That is 15th. So 15th, they will have orientation session, and 17th, they will have the regular batches. So you can pass on the messages to your friends. And don't forget, my friends are there. Buy chocolates for my friends. I will not excuse you, okay? Uh, all of you, all of you. So next one, Dinusha. Dinusha, share your experience regarding part B.
Yes, previously I didn't mark that much keywords and I didn't compare with the question to the answer option. So today I learned how to uh, do that and what the connection with the answers and the question and what I need to listen in the audio. Thank you, sir.
Then Dunisha.
Yes, sir. Before, I think I missed some specific keywords. I marked the keywords and I tried to find that keywords from the audio. So today I recognized that I missed some keywords, and because I didn't analyze so far. Today I understand I want to analyze the question deeply and how to mark the specific keywords. So I want to practice more. I think it's very beneficial for me, sir. Thank you.
Yeah, today we did not touch the audio itself, right?
Yes, sir.
We
So,
did
but
not, we did not
no,
even bother about any audio, but we are able to understand a lot, correct?
yeah, yes, sir. Thank you.
Okay. So next, Odion. What did you learn about part B, Odion?
Okay, sir. Yeah, I listened to your class, your explanation, and your explanation showed me how to through this the words, that's the specific words in the write-up, will allow you to be able to know exactly what the either the doctor or the nurse is talking about concerning a patient. So looking at using the keywords, you'll be able to easily locate the right answer while you are listening to the audio. Thank you.
Welcome, welcome. So, all right. Now we are moving to the next candidate. So after that, Ruvini. Yeah, Ruvini. On the whole, all 6 questions. After doing all these 6 questions, how is your impact? How did it impact Ruvini? Ruvini is busy. Okay, Cincy. Cincy.
Hello, sir.
Yes, Cincy.
Yes, sir. Before I said earlier, actually, sir, today I learned how to pick the keywords. Actually, me also every time select the lot of keywords, the answer. That's why I sometimes I get the wrong answer. But now I know how to pick the correct keywords in the question and answer. I need to more practice. Thank you, sir.
Okay. Yeah, next, Ruvini. Ruvini, are you there? Ruvini. Then Zubi. Hello, Zubi. Can you share your experience? It's no problem. You can just share your experience, or if you're not comfortable, you can just type your message in the chat box. Right. Now, so how many of you have messaged that you are interested? Let me see. Dinusha, Dunisha, Sinsi, then Odion, then Anuja. So only 5 people have shown interest. So fine. So all of you who are interested, you can join the next session. I'm closing this session. So you immediately, you can join the next round. Come on. There we